హాయ్ ఎవ్రీవన్. సో ఇప్పుడు టాపిక్ ఏంటంటే పెయిన్ మేనేజ్మెంట్. సర్జరీస్ అనేది లేకుండా పెయిన్ మేనేజ్మెంట్తో ఎట్లా మనకున్నటువంటి ఈ పెయిన్ని క్యూర్ చేసుకోవచ్చు, ఇది టాపిక్ యాక్చువల్గా. సో నవడేస్ ఏంటంటే పెయిన్ మేనేజ్మెంట్ చాలా ఎక్కువగా వెలుగులోకి వచ్చింది. సో ఎలా ఇది పనిచేస్తుంది మన బాడీ పైన, సో వితౌట్ మెడిసిన్ ఆర్ వితౌట్ సర్జరీ పెయిన్ మేనేజ్మెంట్ ఎలా పనిచేస్తుంది, ఇది టాపిక్. సో దీని గురించి వివరించేందుకు మనతో పాటు ఉన్నారు డాక్టర్ విజయ్ భాస్కర్ గారు, ఇండో బ్రిటిష్ పెయిన్ మేనేజ్మెంట్ క్లినిక్. హలో సార్.
హాయ్
సార్, ఫస్ట్ ఆఫ్ ఆల్ మీ గురించి కొంచెం ఇంట్రొడక్షన్, లైక్ ఎన్ని ఇయర్స్ నుంచి ఈ పెయిన్ మేనేజ్మెంట్లో ఉన్నారు?
for all ABP viewers and all the audience who are present here, a warm welcome for all of you. So I am Dr. Vijay Vijay Bhaskar Bandikatla. So I'm a pain specialist. I was trained in the UK. I did my pain fellowship from Cambridge University Teaching Hospital and a few more trainings in London as well on neuromodulation. Sir was talking about the brain advances. So I was into the spine advances. So my lot of time was spent on the lumbar spine. So I did my training and research as well. And then I worked as a consultant for a few years over there. So in total, after about 15 years of my training, I moved back to India. So then I started the Indo British Advanced Pain Clinic, and I also consulted most of the big corporate hospitals over here. So that's how my journey in pain medicine has been happening. So it's a very fascinating experience. So sir was talking about earlier of all the surgeries that you can do to control various problems within the brain. But my whole endeavor was to not to do that surgery and still be able to get a control of the patient's pain. So I'm into pain specialization, and pain is the one biggest symptom that will bring a patient into the hospital. Just because of that, you do, patients come into the hospitals, they see the doctors, they get all the investigations, everything happens because of that. And then all surgeries that you do, all medicines that you take, most of them are for controlling your pain. But unfortunately, that surgery will have a lot of problems. As I was mentioning before, you walk into the theater, you come back dead. Maybe if not the patient is dead, but still they'll have a lot of morbidity. Surgical problems will always be there. Once you go in, cut and do things, there will always be a problem. So my quest is to how to avoid that surgery and still control that pain, give the patient that functional activity that what they need for their life. So that's what I've been practicing so far. And we do the same thing at the Indo British Advanced Pain Clinic. We get all sorts of pains here, and lots of things will be treated.
So could you please tell me why back pain is so common?
If you look at it, as a human being, we adapted a different way of activity as opposed to any other animal. Most of the animals are supposed to be quadrupeds, right? So we are supposed to stand on 4 legs. But then since the chimpanzees and some of the other animals, we started standing upright. We're standing on our feet, and then our arms came into use. So for being able to do that, we have to balance a lot of our body. But it is not supposed to be built like that. You cannot have your lumbar spine and the entire spine with these little bones one on top of the other without any other external support. It's not possible. You can't keep the bones upright like that. Then how would you keep it standing? So these bones, they will have to stand upright by using all the muscles, ligaments. There's a lot of balance which will have to happen within the body, and you have to keep on balancing that. Otherwise, none of us can stand upright, right? So even with the tiniest of the aberrations in how you position yourself, you're going to fall down. You see that very often with the very small children who are still growing up. The same thing happens with the very old people, or maybe even in between when you are playing, or maybe some diseases that happen, you just fall down very easily and hurt yourself. So the whole point is how to maintain that stability of a person so that will stand upright. So most of the bones which you are talking about, and in between bones you have discs, and then they're all supported by the ligaments. You all would know as medical students, there are lots of these kind of things, and then the muscles which are balancing out all these things. So there is an equilibrium which is running. Whenever this equilibrium is missing, you will have back pain coming. So you are straining your muscles to start with. Most of the back pain comes from the muscle strains. So that's the most common thing. But then there could be lots of other factors. We will discuss a lot about that. But then these are all the things which will cause a lot of back pain to the patient. It is so common. Back pain is so common. I don't know how many of you will know that almost 85% of the general public will have back pain at some point in your life. You might not be having back pain today, but there is a likely possibility that most of you will experience back pain at some point in your life. Be it with your study while sitting, do nothing, but still you can get. You lie down for a little longer, you can get back pain. And you do fall down, activities, injuries, accidents, so many things. Back pain is almost 100% for everyone. 84% is what the WHO quotes.
వై సర్జరీస్ ఫెయిల్డ్ ఎందుకనంటే స్పైన్ సర్జరీ చేయించుకోవాలంటే చాలా మంది భయపడుతూ ఉంటారు. బికాజ్ అది ఫెయిల్ అయితే ఇంకా అసలు మనం నిలబడలేమేమో, సో మన లైఫ్ అంతా స్పాయిల్ అయిపోతుందేమో, సో అలా వెళ్తుంటాయి. ఎందుకు ఫెయిల్ అవుతూ ఉంటాయి?
So the most important thing, the title is why surgeries fail. As I told you, back is a very, very complex organ. The entire spine that you look at is a very complex thing. So there are lots of different individual things which are there. And then when you are going to go for a surgery, imagine you have a disc problem. Between every two bones in your lumbar spine, there is a little cushion-like thing. It's acting like a shock absorber. And when the shock absorber fails, slowly the disc material, which is like a gel inside, it will start to leak outside. But what is there behind the disc? You have the spinal cord, you have the nerves, very, very sensitive structures are sitting behind the disc and the spine. And when you try to do a surgery, which is, as I told you, the most common thing, about more than 50% of all the back pain comes from pure discogenic. It is the disc problems. So when you try to go and operate on the disc, you just can't go just like that. You will have to access, you have to cut open. On the way, you have the spinous processes, the bones are there. You have to cut the bones. You probably will have to remove the muscles which are there on the way. And then the nerves come in the way. You have to put them aside. Without injuring any of these things, you have to reach to the disc. And finally, you reach the disc. Where is it? The disc, the gel is present inside the disc. So to reach that, you have to cut open the disc outer cover. When you do all of this, and then you do a surgery there, what will happen? After any injury, any surgery, what would you see? A scar tissue. And this scar tissue is going to be our biggest enemy after the surgery. Mind you, almost like 90 to 100% of spine surgeries are going to be affected by the scar tissue. There can be adhesions, there can be scars. So it's the research which proves almost like more than 90% of patients will have a scar tissue inside the spine. And you can't avoid it. So these are the reasons. So you are opening up the disc, you cannot close. Once you open the disc ring and you take out the disc bulge, and you cannot put them back together. You can't suture it. Right? So that is one reason. And the nerves get damaged while you are cutting open all these things. Various structures are getting damaged. And then the biggest enemy is the scar tissue. With all of these things, surgical failure is very high. And when you destroy the equilibrium which is present in the spine by putting some screws, by putting some rods and then fixing the whole spine, how will you bend afterwards? Whenever you bend, you are putting more pressure on the discs above or the discs below. There is no way that you can avoid all of these problems, which is exactly why almost out of every 10 spine surgeries, out of every 100 surgeries, let us say, 30 to 40% of them will continue to have pain. Do we know this? No. When you think, okay, the disc is bulging, let's take it out, I'll be normal. You will never be normal after that. Right? There is a lot of problem which will be following you once the surgery is happening. So my whole quest and our thing, what we do at the Indo-British Advanced Pain Clinic is to avoid the surgery. Keep it as far away as possible. And that's what we're trying to do.
సో సర్జరీ కాకుండా పెయిన్ మేనేజ్మెంట్లో ఎలాంటి ట్రీట్మెంట్ ఉంది మరి ఇందులో?
So,
ఎలా ట్రీట్ చేస్తారు అని?
as I was trying to tell you, once you identify where the pain is coming from, for example, you could be having a problem coming from the disc, which is the most common thing I told you, but then you could be having a nerve which is getting compressed by the bulged disc, which is happening within the spine, which is what we call it as sciatica. Okay, with a lumbar back pain, if the pain goes down into the leg, it's called sciatica. That is the disc bulge compressing on the nerve. So when this thing happens, so when these kind of problems are happening, you identify exactly where it is happening. We have very advanced investigations these days. For example, we have an MRI scan, and we have so many advances within MRI scans. For example, contrasts are used to highlight where the scar tissue is there for people who had a surgery. So we use these kind of advanced investigations. At our clinic, we also use very advanced spinal analysis. Digital spinal analysis is a very advanced investigation that we do. Which part of the spinal muscle is contracted? So we target our treatment to where the pain is. Once the target is identified, then we reach out to that place which is causing the problem. For example, if you have a discogenic pain and the gel is leaking out, we actually put a needle into the disc, do some treatment so that the disc gel is hardened. Once the disc gel is hardened, it's not leaking anymore. Thereby, you will reduce the pain of the patient, and also you avoid the surgery which is going to happen to the patient. So this is a remarkable thing that we can do. There's a number of techniques that we use. For example, there are certain chemicals that we use, gases that we use like ozone. Lasers are new advances that we have. There's electricity, radio frequencies. There's a lot of things that we use to make the gel harder, make the disc ring better, and also various other things like injections onto the nerves. These are the nerve blocks that we do. There are ablations onto the joints that you have. So there's a lot of things that we do, and when it is all coordinated to the requirements of a patient, you can avoid that surgery. That is
అంటే సర్జరీస్ని అవాయిడ్ చేయాలని అందరికీ అనిపిస్తుంది.
Yes.
సో హౌ మచ్ సక్సెస్ రేట్ ఇన్ దిస్ పెయిన్ మేనేజ్మెంట్?
You would be very excited to know almost like 98% of surgeries, they don't need to be done at all. So most of the surgeries can be avoided. Only the ones, as doctors, budding doctors who are here, spine surgery is only indicated when you have weakness in your leg, and then your bowel and bladder, what you call it as cauda equina, when that is happening, or the bones are falling apart, what we call as listhesis. And these things are corroborated by your MRI scan, where you have a lesion that you can operate. Only then surgeries need to be happened. Otherwise, you are bound to have a patient who will be following for the rest of your career that you have done a wrong surgery for them, and now my condition is worse than what I was before. So we cannot let this happen. So basically, the surgery is a last option for all of us.
Right. Thank you so much, sir. Thank you so much for joining with us.
Thank you so much.